Hey guys, this is Dr. Hub. Today we'll look at some uterine signs in pregnancy. So first we'll look at the Palmar sign. So the Palmar sign, it means that there is a regular and rhythmic uterine contractions. There is a regular and there is rhythmic contractions, and this is of the uterus. So the regular rhythmic contraction of the uterus. So this happens at 4 to 8 weeks. Next sign will be the von Braun Fernwald sign. So the von Braun Fernwald sign. So this is the irregular softening and enlargement of the uterine fundus. So it is the irregular. So it is the irregular softening and the enlargement. So it's irregular softening and the enlargement of what? Of the uterine fundus. Of the uterine fundus. And this is about 5 to 8 weeks. Then we move on to the Pisc A6 sign. The Pisc A6 sign. So this is where one half of the uterus is firm. So half of the uterus, it remains firm than the other half. So this is in the in the lateral implantation. Then we look at the Heger sign. So the Heger sign, it is where the firm cervix contrasts with the softer fundus. So there is the firm cervix. So this firm cervix, it contrasts. So it will contrast with the softer fundus. It will contrast with the softer fundus and the compressible interposed softened isthmus. And the compressible interposed softened isthmus. So this will be about the 6 to 10 weeks. Next we look at the Leyden sign. So what do we mean by Leyden sign? The Leyden sign is nothing but the softening in the midpoint of the isthmus. So there is softening in the midpoint, and this is of the isthmus. So the softening in the midpoint of the isthmus, and this is anteriorly. So it's about 6 weeks. Then we move on to the McDonald sign. So the McDonald sign, it is presence with the easy flexibility. So there is presence of the easy flexibility of the uterus on the cervix of uterus. So easy flexibility of the uterus, and this is on the cervix. Then comes the presence of, we look at the Goodell sign. Goodell sign, it is the softening of the cervix. So there is softening of the cervix, and this occurs in about 6th week. Then we move on to the placental sign. So what happens in terms of the placental sign? So here in placental sign, there is a cyclic bleeding occurring. So there is a cyclic bleeding. So the cyclic bleed will occur up to 12 weeks of pregnancy. So this will occur at about 12 weeks of the pregnancy. Then we move on to the Jacquemus or the Chadwick sign. So what is the Jacquemus or the Chadwick sign? So the Jacquemus or the Chadwick sign is the dark bluish red. So it is dark. It is a bluish red. So it is a dark bluish red as well as a congested vaginal mucosa. The congested vaginal mucosa. So this is by the 8th week. Next what we have is the Osiander sign. So the Osiander sign, it is the increased pulsations felt through the lateral fornices. So it is the increased pulsations. It is felt through the lateral fornices. So it is felt through the lateral fornices.